I'm Shahid Shah, and I'm an entrepreneur in residence at the AHIP Innovation Lab. I'm helping to organize and will be a moderator of the upcoming HL7 Partners in Interoperability Summit taking place March 21st and 22nd in Atlanta. So FHIR is very easy for people to use, but they need to get together and understand which data they can exchange. So the HL7 Partners in Interoperability is helping bring those people together to understand how to better connect and communicate the existing use cases, new use cases, and a variety of other techniques and technologies that can be used to help make sure that interoperability becomes real. So what is the HL7 Partners in Interoperability Summit and who attends? I like to think that the Partners in Interoperability is really not so much about the technology, although an enormous amount of conversation happens about technology. But really, the Partners in Interoperability is unique because it brings together participants from health systems, insurance companies, pharmaceutical manufacturers, pharmacies, the public sector, and really bringing together these multiple industry segments to one gathering and to talk first and foremost about why is it so hard to do interoperability today. Once the senior executives that are there, once the business analysts that are there, once engineers and architects that are there understand why interoperability is so difficult, then they can move on and help their internal institutions as well as people across the ecosystem improve that capability. People talk a lot about data blocking, and almost everybody complains and points fingers at each other about why interoperability is not happening today. And really, the simple problem is that we don't have clinical interoperability because we don't have business interoperability. We cannot seem to get multiple providers together to agree on what they need to connect and share. We can't get insurance companies to agree with healthcare providers. We can't get the healthcare providers to agree with pharmaceutical companies. The pharmaceutical companies don't agree with pharmacies themselves. So when we put everybody together into a single event like the Partners in Interoperability, we think that we're going to be able to move faster and easier towards a more interoperable future. We've all learned that the low-hanging fruit of interoperability, which is the ability for systems internally to connect to a single institution and moving beyond from a single to multiple institutions, is now exhausted. What we need to do is to involve multiple stakeholders across multiple institutions to make value-based care and patient-focused care possible. So this is your opportunity to network with your peers and solution providers who have successfully implemented FHIR. Here you can learn about FHIR and how it's being incorporated into electronic health record systems, lab systems, imaging systems, in fact systems you may not even know that have the ability to connect with FHIR. So I look forward to seeing you in March at the HL7 Partners in Interoperability event. Thank you.